We are with Stacey and Kat. Stacey is a child feeding specialist, and Kat, you are the founder of Doddle. We're really excited today to be listening to your Q&A, sharing insights and hints and tips to introduce self-feeding and at the start of weaning.
Thank you everyone for joining us. This workshop, we've got half an hour, is all about encouraging independent eating from the start. I'm a real believer in independence and, you know, the kids, giving them all the skills and the tools to do stuff themselves rather than us doing it for them. So yeah, this is definitely something I believe in. So the reasons, so the main thing we're going to get out of this workshop is why independent eating is important for your baby, and knowing how to start and what choices you have. And there might also be some, as you go through weaning, you get to some sort of toddler challenges, which can be all sorts, and there's opportunities for you to ask questions as we go through this. So any burning questions in terms of how to manage some of these challenges, please fire those questions to us. So yeah, it's just a hopefully informative opportunity. Me, from my experiences as a mum and inventing Doddle, and obviously Stacey, who's our specialist. So maybe just a quick introduction. Stacey.
Hi everyone, so my name's Stacey Zimmels. I'm a feeding and swallowing specialist speech therapist, and I've been supporting families with all aspects of feeding and eating for around 20 years now. I'm also Doddle's expert partner, which is why we're here together today. You can find me on Instagram over at Feed, Eat, Speak, and I also support families one-to-one if you ever need anything. And I'm really looking forward to sharing my expertise and knowledge with you today.
Yeah, and I've already introduced myself, but I'm Kat and the inventor of Doddle, and that came about from my experience with my 3 kids. So I had my baby, and then 15 months later I had twins, so meal times for me were a real challenge, and especially getting them to sort of feed themselves, etc. So I have had a lot of experience in terms of cutlery and feeding equipment, and spent years sort of researching, etc. So really I'm coming at it from being more of an expert in the cutlery side. Right, so choosing your weaning method, and that was really my experience feeding my 3, and it was sort of finding any way to get the food into them, any opportunity. So for me, if they were all sat on the floor, I'd get a bowl, get some food, and sort of go around shoving it in their mouths. And it wasn't ideal, but it was sort of just trying to almost tick the box. And, you know, if I had much more advice or the tools or opportunity to that's available now, I think that my experience would have been quite different. But I'm going to hand over to Stacey so she can give us some more information on this part.
Okay, so when it comes to choosing how you're going to wean your baby, and when we think about independence, actually you'd be surprised to know that any method that you choose to use, or any combination of methods, will be able to support your baby from the beginning to feed themselves if you choose to do that. So the most commonly known method is baby-led weaning, which is where you would place the food on the table for your infant typically, and then give them an opportunity to pick that food up, explore and feed themselves from the start. And the advantage is that, you know, day 1 they are independently eating, so it can be definitely helpful when you've got your hands full. Typically it's easier for parents because you don't have to prep much in advance. You're just looking at just chopping the foods you're eating in a way that your baby can manage those in terms of their hands and their mouth. And actually, you know, it's one meal for all the family, just slightly adapted for your infant, as opposed to pureeing, etc. Now, that doesn't mean that if you did choose to offer your baby purees at the start, that there couldn't be an element of learning how to independently feed within that. So the two ways that that would be is firstly to offer finger foods alongside the pureed foods that you're giving your baby. So you get like a bit of both. And your baby is practicing the exploration, the picking up, the putting into their mouth, the eating from the beginning, and then you could be spoon feeding them as well. For this method, or for baby-led weaning, you need to wait for your baby to be sitting upright and really independently. And lots of families do choose to do a sort of combination of starting with purees and then having the finger foods alongside, or introducing them just a couple of weeks later. And the advantage of that is that they're getting the sort of tastes and nutrients from the purees sort of a little bit earlier on. And then the final thing that you can do, if you did opt to offer some purees alongside finger foods from the start, or even if you're doing baby-led weaning, is to load up a spoon full of food for your baby and then place it on the tray in front of them for them to be able to pick up and feed themselves. So this would cross, you know, all the different methods of eating and is totally independent, and your baby can still decide the volumes of foods that they want and how they want to eat them. In my experience, you know, it's one of the reasons that I partner up with Doddle, is that short-handled spoons are definitely the best for loaded spoons in the early days.
So are there any questions at this point? We've just had a question posted earlier, and this is for you, Stacey. I really want to offer finger foods, but it makes me so nervous. I put it down and then get nervous and take it away. What shall I do?
It's really tricky. I mean, I would say don't put yourself under stacks and stacks of pressure if you're very nervous. It's going to cause you distress. What you'll probably notice is that as your little one gets started with eating, your nerves will start to dissipate, because you'll see that they are almost like growing up in front of you and seemingly look a lot more capable, say at 7 months, than they might look at 6 months. The other thing you can do if you're worried, if you're nervous, is have another adult with you the first time that you introduce finger foods. You can educate yourself as to what might actually be expected in terms of gagging, understanding the differences between gagging and choking, which is often a fear that parents do have, and also what to do in the very, very, very rare occasion that an infant might choke. Sometimes that can be quite empowering to know, if you're in that situation, what you would do. And then finally, what you could do is offer your little one finger foods that are very, very soft, which makes it much easier for them to manage. Things like little raspberries that you can squish down, or very soft, well-cooked sticks of courgettes.
So any advice from one-year-old forward? She keeps throwing food on the ground and even cutlery.
So we're going to cover this a little bit later, Monica. So if you can stay on, we'll probably end up answering that in the third section. So keep on the Instagram and we'll come to that. Right.
So would it be useful maybe to play the video first, and we go through that, and then we can come back and cover these areas?
So the next section here is about learning to self-feed, and obviously we're keeping to the theme of independent eating. So the first step in learning how to feed yourself is to give your little one the opportunity to explore the foods. There's loads and loads of reasons why using your hands as part of the weaning experience is beneficial and advantageous to your baby. Think about it as they're like the gateway to the mouth. So often, if you're feeling a bit uncertain about a new food or something, you may find that yourself sort of reaching out, touching it, exploring it, feeling it, and that's what your babies do, and it gives them clues and ideas about what it's going to feel like, and therefore they're going to be much more likely to want to eat it. The other things that doing it in exploring and in self-feeding is priming the very key skills that they need, which is grab and put in your mouth, and they can be transitioned a bit later on to feeding and eating with cutlery. The second thing at the beginning, when you want them to eat independently, is help them by making the food that you're going to give them the easiest that they can to pick up. So at 6 months, when you first start solids, your baby is going to be able to just do a grab, a whole hand grab movement. So if you can make the food grabbable size, so thick enough to grab and sit in the palm of their hand, and long enough so that there's a little bit sticking out of the end, so that when they lift up their hand and take it to their mouth, there's a little bit sticking out. That would be the perfect size and shape for getting started, so that they have really positive experiences, and actually some of it might go in. So for role modeling, what that basically means is showing them how to do it. And the simplest, easiest way to show a little one how to do it is to do it with them, so that you eat meals together and you eat the same foods at the same time. And by eating the same foods at the same time, your baby is observing, watching, and start to copy you. So for example, I get asked this a lot, and I got a question just this week about it, saying, you know, my baby will play with the food and my baby will eat it if I put it in their mouth, but they haven't worked out how to touch it and then take it to their mouth. And that's where role modeling really comes in. Finally, we're going to Kat's going to talk you through the idea of what the right tools might be, alongside exploring with your hands in terms of getting started with cutlery. And hopefully we've got a video to show you.
But yeah, in terms of the tools, and this was the issue I had, that essentially when my kids were little, it was just small versions of adult cutlery, and that was the only thing available. And if you think as adults, it's almost like using like a garden spoon or fork, in terms of it's so difficult. They haven't developed the skills, the dexterity, etc., to control these implements with long, thin handles. And so it is we're making it very difficult. And this was through all my research and the long journey to developing Doddle, was creating the perfect thing that worked with babies and toddlers, based on their sort of stage and their abilities and their skills, etc. So it worked with them rather than against them. And back to the long handle, as I say, it can be quite uncomfortable to hold, these longer, thinner handles. It can be difficult for them to hold when they're first starting out weaning. Then, as we'll talk about, you know, it's really, they're exploring cutlery. It's really normal for them to, you know, not know which end they need to put in their mouth. They might stick the kind of handle end in. And the benefit with the shorter, more compact handle is that then less likely to sort of gag on the cutlery as they sort of jam it down their throat whilst they're exploring. So these kind of short, compact, easy to hold handles is just making the process a lot easier for them as they start to explore cutlery. Seamless. Right, so we just want to start by offering your baby cutlery, and the best way to do that is just every meal when you start weaning is just to put cutlery down, and ideally both utensils, because we want them to be using both hands, working both sides of the brain, and so just put it down, and they're exploring the food, and it's them getting that familiarization that cutlery is associated with meal times. Then you can see that you can then offer it to your baby. So if they're just completely ignoring it, you can pick it up, sort of put it near their hands or in front of their face, so they can sort of see it. And then they might grab it, they might wave it around, they might immediately kind of throw it on the floor. They might start grabbing it and kind of eating the handle end rather than utensil. But this is all absolutely fine, because they're just exploring, you know, they don't understand what cutlery is at this point. So you've just got to really let them explore, but the key is just keep offering it with every meal, so you're keeping that consistency. And then slowly the baby will start to put, especially if you're doing that role modeling that Stacey talked about, and they will start to copy and understand how then the cutlery works. So you can see now the baby is starting to get, you know, the cutlery in the bowl, some food on the cutlery, and taking it to their mouth. Now you can, with the fork, you can stab some softer foods. So here we've got some mango, and you can then offer it to your baby so they can, again, keep exploring, sort of chewing the food off the cutlery. And this is all part of the process of learning. So I think the key is it's not something that's overnight, it is a journey. And this is why we start, you know, when you start weaning, and keep on that journey, keep offering the cutlery, their skills will keep improving. We're giving them something that's comfortable, easy for them to use, and that just keeps improving. You can see this little one is picking up those skills, using it in both hands, is getting the idea. So by the time they're ready to transition on to, you know, the next set of cutlery, we do the Dodd children's cutlery, they've actually got a reasonable level of skill and coordination, and they get the idea of how the cutlery is working. So hopefully that just gives an idea in terms of it's going to be a bit messy. It's just all about exploration and familiarization. So it's not about them like from day one sort of mastering cutlery and straight away, you know, getting it into the food and into the mouth. Any questions based on what we've talked about so far?
Kat, this one might be one for you, because somebody's asked about short-tipped, sort of kinder on the gums types of spoons, but actually your weaning cutlery is different to your other cutlery, isn't it? The metal. Yeah,
and actually that's a really interesting point, because you know, when we're looking at the research, etc., there is the option you can go for the sort of silicone, the very soft spoons. Now the issue with that is that actually they can get chewed very quickly and damaged and become quite rough. And what we want is the experience to be as enjoyable for the baby as possible. So, and this is where cutlery can sometimes be overcomplicated in terms of you have, I don't know, various shields if you're putting it in the mouth, and actually that's quite, can be quite uncomfortable. If you imagine eating like that, that wouldn't necessarily be a comfortable experience. So with the plastic that we use, for instance, it's plastic as opposed to metal. So we wouldn't recommend metal when you start weaning, because as we've talked about, their kind of level of control and coordination is not great when they're starting out. There may be a risk they sort of bump their cheek or whatever. So plastic cutlery when they're starting weaning is definitely what we'd recommend. But obviously you want to transition onto metal, because metal does have quite a different feel and a different taste. So if you stay on plastic, then it's potentially getting harder as they get older to move on to using metal cutlery.
And I'll just speak to the gums bit, because actually our babies are a lot more resilient than you think. And when you're using something short-handled, that coordination side of things, it's going straight in, and you get a lot less miscoordination that you might with a longer spoon. So whilst there are silicone versions and products, sometimes they can be harder to scoop with once you get to that phase and stage. So obviously you need to choose what's right for you, but actually it doesn't necessarily make sense or equate that the gums are going to be in any way traumatized if you don't use a very, very soft spoon. And there are things about those that maybe hinder the experience also.
There's a question there in terms of the difference between long handle and short handle. So we've sort of covered that in terms of it's the ability, the skills and coordination to control a long handle, and we're talking about babies with very limited control and coordination at that stage. So that's why the short handle is much easier for them to manage hand-eye coordination, not wave it around like a weapon essentially. Typical toddler challenges. Stacey, over to you.
Sure, okay. So you know what, it's all well and good talking about how to get weaning off to a great start, and then they turn one and you're like, oh my goodness, on a whole different playing field. Just when you think you've got it sorted, everything changes with toddlerhood. And one of the classic toddler challenging behaviors is food throwing. And we've already had a question about this. It's one that I am almost most commonly asked on my social media platforms, is like, help, what do I do about food throwing? And so my first answer is work out why. There's usually some sort of reason that they start to throw food. So One might be that, and one very obvious one can be that they're finished. And so they've had enough, they're getting bored and they start to throw it. So you can teach them finished, or teach them giving you their plate when they're done, and pick up and recognize those signs that food throwing may be finished. If you suggest that to them and they're like, yes, I want to get out the high chair, then you know that you've got that right. Another typical sign that food throwing, why they might be food throwing, is sometimes as we start with these very long stick pieces in weaning, but as they develop their hand skills, they might want to start to practice other things. So one might be like their pincer grip, and they're getting a bit bored of picking up the food in the shapes that you're giving them. So you can start to experiment with cutting the food up into smaller shapes. And the other thing around boredom is that food throwing could sometimes be a sign that your baby's needing to progress through to cutlery. And actually, I had exactly this experience, and this is how I discovered Doddle, because my little boy Gaby was an absolute food throwing nightmare. And the first time we did it, we cut the pieces differently, and that sort of sorted it out. And then as he got to about 1, he started doing it again, and we did the finished thing. And then that's when I realized he probably needed some cutlery and something else. And I asked on those mums groups, can anyone make any recommendations? And Doddle were recommended. And I don't know, Kat, from your experience, was this sort of part of, again, what helped you conceive the idea and think about developing the Doddle cutlery?
Yeah, well, as you can see from the images on the presentation, that was my experience. And it was both of us getting frustrated, like Toddler, because they couldn't really do it. And it was these challenges. And so that would be quite typical in terms of it just gets very messy, and or start like chucking the bowl, and mine, because then obviously it's getting messy and the child is sort of unhappy. So for me, like when I set out meal times were meant to be this, I was so excited to start weaning and going on this journey, but the reality for me was so different in terms of very rarely was it enjoyable. It was always seemed to be quite stressful. So anything can do to make other mums and dads meal times that much more easier and enjoyable, then absolutely all for it.
Just for the last couple of points, because I'm aware we're coming to the end of our time, getting cross and frustrated at the table is not dissimilar to food throwing. It's often because they're done and they just want out. And this is where it's really important to be as responsive as you can to your little ones and not be too focused on how much they've eaten and how long they've spent eating, but actually following their cues and following their lead when it comes to them letting you know they're done. Also having realistic expectations about how long a toddler might sit at a table for, particularly if you're having family meals. It might be that your 5-year-old's happy for half an hour or so with the rest of the family, but your toddler's done in about 10 minutes. And it's not unreasonable to allow them to leave the table, and then if they want to come back a little bit later and sit at the table and continue, you might find at age 1, age 2 that is a strategy that you implement, and then when they're older you get them to sit for a little bit longer. And then finally, wanting to be fed by you. I mean, this can happen for lots of reasons. Sometimes, there's a new sibling and they just want a bit more mummy time or dad time, and they just want a bit more control and they want to control you. And those sorts of things, can be mediated for by giving them a little bit more attention. You can try and negotiate with them a little bit. Sometimes it helps to say, okay, I'll give you the first spoonful and then, you can carry on. And I've just got to get up and get something out of the fridge. And then sort of once they get going, they're sometimes all right. And another way to do it, again, is it a sign that the cutlery they're using sometimes just isn't fit for purpose? So for example, they're still using, they're using something bendy and silicone, and they really want to stab their fork, but they just can't get it on, and it gets really difficult, and they just want to eat, and it's frustrating. So again, this is where selecting cutlery and making sure that you've got the right product that works for your child is really helpful. So they would be my tips for that. Yeah.
Thank you, Stacey. Well, I think our time's almost up. We just had one last question. So how long does it take for a little one to learn how to stab a fork, because they always miss? And I think the sort of short answer to that is that every child is different, but this is where if you've got shorter, more compact cutlery, they will naturally find that easier. And as they start to, that hand-eye coordination improves, then it should be something that develops reasonably quickly. So for some it might be over, could be a matter of days, others weeks, but for others it might be months until that does develop. So as I say, I know it's a kind of well-used phrase, but every child is different. So don't panic, but as I say, just keep offering it so they can keep building and learning those skills. But yeah, the key is go for the shorter, more compact handles, because if you can think of yourself as an adult, if you were using something disproportionately long for you, you would find it much harder to hit your target. So so that's really the key.
And sometimes progressing to metal, Kat, for stabbing can make a difference for some children.
Yeah, absolutely. And with the baby cutlery, obviously, you know, they're learning. So we've got a spoon and a fork so they understand what those are, because you see sometimes some very different looking sort of utensils that don't represent a spoon or fork at all. And so that's then quite an interesting transition when they need to start to move on to sort of normal cutlery, if you like. So so using something that is effective at cutting or stabbing, because that's where you'll get frustration building. If you go for particularly blunt instruments as they get older, so they're not successful at ever stabbing or cutting anything, then you're going to have the same sort of issues of frustration. Thank you for joining. Thank you very much, Stacey.
Thank you. It was lovely to be a part of it,
Great.
represent Doddle and be part of Weaning Week. So thanks for having me.
Okay, perfect. Right, signing off. Bye, everyone.
Bye-bye.